Province, obviously the numbers currently stand at 45, but of course one of the great concerns now is the internal transmission. So authorities are working so hard in making sure that they try and contain that. But to try and look at the picture in the province, joining us now is the Health MEC Masuku here in Gauteng. MEC, thank you so much indeed for your time. So just bear with me. We'll try and work as we try to deal with the distance. But in terms of your institutions that you have set aside to deal with COVID-19, how are they doing so far?
So far, we have not had the overwhelming numbers that we thought we have, but we have already started to create more spaces in our facility. And currently, we are looking at around 263 beds that will be available for people for immediate admission, particularly for those who will require it. Currently, we have been very fortunate that a lot of people have not, those who are infected, have not required any serious hospitalization.
And MEC, when you look at the condition, obviously Gauteng is leading in terms of the numbers we have so far. But do we know exactly the conditions of the patients we have?
Yeah, that's why I said we have been very lucky in the whole space that most of the patients that we have been found to be positive with coronavirus infection have actually had mild symptoms which normally require just isolation and observation from home. And most of them have done a lot of self-isolation.
And we've seen you taking a very drastic step, going as far as approaching a high court, because there was a bit of resistance from some family to be quarantined. How's that situation going?
I think it was handled quite well, and I think we like to pay special gratitude to our justice system, who actually came into the party to support our effort in terms of ensuring that we protect our citizens and also protect our healthcare system. And I think it has been quite a good thing that we have done, because people now will realize that we need everybody's cooperation for us to be able to defeat this pandemic.
And it's a national disaster. I would imagine that the laboratories, private, public, they're working around the clock in making sure that they test and validate all the samples that they have.
I think the most important thing is that our national laboratory is the one that will only do quality assurance. Even when you do a test in private, some of the tests still has to be verified and quality assured by the national laboratory. The minister has taken steps. He's meeting with the executives from all the pathology labs across the country, just to make sure that they communicate basically three things. One, that quality assurance should be done by the national laboratory. The issue of curbing the cost and controlling it so that we don't get people benefiting and profiteering over this pandemic. And the third part is just to try and make sure that we only get one form of communication, which will be through the minister.
And MEC, just in terms of the procurement of your medical supplies, do you believe we have a sufficient stock at this point? What's your observation? Because, for example, you've had trade union like Nehawo calling for the state to seek assistance in Cuba.
I think the important aspect about our equipment is that we don't have enough, but we are in a process and we are making a call even now, maybe that we should make the call that all the suppliers who believe they've got enough stock in terms of your masks, gloves, gowns and all the protective gowns that we use in our health facilities, they should contact our health department and all other departments for us to be able to procure as many of this equipment and resources as possible, because we won't be able to get to a point where we'll say we have enough. We just have to make sure that our health workers in particular are well protected and they are actually safe from the virus itself.